everybody, and welcome back to another episode of our YouTube series for SpeechTherapyPD.com. I'm your host, Stephanie Michele Sweigart. I am a licensed and practicing school-based SLP out in Los Angeles, California, and my pronouns are she, her. And again, we're here today with SpeechTherapyPD.com. We have a very special guest joining us today who is an expert in the field of speech therapy and in promoting cultural competence within our profession. So I'm very excited to welcome Dr. Katrina Miller to our show today. Thank you so much for being here with us, Katrina.
And thank you so much for interviewing me and being here, Stephanie.
Absolutely. For anybody who's listening, tell us a little bit about maybe what you're currently involved in or where you're coming from today.
Okay. Again, like you said, it's Katrina Miller, and I have been a practicing speech language pathologist, oh my goodness, probably over 25 years. I've had varied experiences from everything except that birth to 3 age group. So I've had some public school, private practice, university, some hospital. I'm currently a founding director at Shenandoah University for their speech pathology program.
Oh, wow.
Is supposed to be opening in fall 2024. So we're pretty excited about that. I have worked extensively with clinics. I've done some international speaking and teaching and held a clinic in China with bilingual students and clinicians, monolingual students and clinicians, and of course, monolingual, bilingual clients. So that was pretty exciting working with the university there.
Wow. I have never ceased to be amazed when I talk to SLPs and I hear all the different hats that they're wearing and all the different experience that you have and what you're coming with and inside the country, outside of the country. So I'm super excited to be able to talk with you and have you share some golden nuggets with us and for all the SLPs and the SLPs who are listening. And on top of that, we know you also author all the work that you're doing. We know you also authored a course on SpeechTherapyPD.com called Cultural Responsiveness and Reflective Practice in Clinical Supervision. And this was just recently, so we're excited to kind of dive into that today. Maybe if you could share with us, a golden question we might ask you would be, what would be 3 takeaways that our audience, SLPs or SLPAs who are listening, what would be 3 takeaways from your course that they can go and implement into their professional roles immediately as it relates to cultural responsiveness and reflective practice in clinical supervision?
One of the things that I think colleagues can take away is the characteristics of a culturally responsive clinical supervisor. Often we utilize some of the same techniques. You remember the techniques that we use for our clients and our patients and our students, but we often forget that as supervisors, whether that be of students, clinical fellows, SLPAs, or other colleagues, that those same principles and cultural differences that we apply should be something that you consider when you're working with students. I also would hope that you got a renewed sense of what reflective practice is and that we do it often, not even thinking about it, but hopefully kind of fine tune some of those skills and maybe present some additional ways to do reflective practice that you hadn't thought of as a professional and also as a clinical educator, and be able to also be more aware of your own cultural biases that you may have that could possibly interfere with your treatment or with your interaction with colleagues.
Wow. Okay. So you're giving us lots to think about. And I love how you're talking about a reflective practice. And if you will, just sort of a broad stroke for anybody that's listening, would you be able to give an example of that?
Yeah. Some of the things we often do as allied health professionals is we think about our therapy session, what went really well or what didn't go so well. We do it kind of naturally, but often that's a skill that's difficult to teach or even difficult to fine tune. So what are some other ways that you can do reflective practice? And one thing that I have found is that we often look at the skills, but we don't look at the emotion or the feeling behind what we've done or why we've been in the moment. So, okay, so how did that make you feel as a clinician when you were able to do that, or you weren't able to do that? So kind of being mindful of those feelings also, especially is important with novice clinicians to be able to touch and to tap into that, because it helps you to be more effective. We know that when you're mindful, it keeps you in kind of centered in terms of what you're doing and ways to approach it. We look at journaling, of course. We've also looked at things in terms of being able to keep just ideas of what you're doing, narratives. Of course, we do that feedback portion, but there's also things we can use in terms of the mindfulness component. How did we feel when we did that, or when we didn't do that? And being able to hone that skill in terms of thinking on our feet. We often do the reflective practice after we've done the therapy session, but it's a fine art to be able to do the reflective practice while you're in the moment, being able to
Wow.
shift gears. And often that's really challenging if you're teaching a student that, because they don't know where to go with the next step. So those are kind of reflective practices, things that we can fine tune
I
as
love
we.
that. Yeah. So being mindful, being aware, opening up your awareness, bringing your curiosity, not only outward, but inward, and tapping into what you're feeling in the moment on how something went or how something didn't go, and
Yes.
kind of looking at doing that type of reflective practice in the moment and not just after the moment. But I'm assuming both, are great opportunities to journal. You're mentioning to journal and kind of write down and digest and process the
Yes.
experience that you're having with whoever it is that you might be supervising.
Yes, it helps you to be a little bit more mindful, because sometimes we get so stuck on the data or making sure we've cut, track of how many successful things, that we forget the other part of the mindfulness. Was it something else that maybe you taught, or maybe that your student picked up or your client picked up, that helps with the communication style, to kind of be aware of all the different things that come into communication? Mhm.
I love that. And I love how you mentioned in this self-reflection practice, you talk about examining your own biases. And
Mhm.
I think that's so important. And the assumptions that we make and our cultural conditioning that we all carry that can look so different from person to person. And I like how you bring up this mindfulness practice for really increasing our self-awareness and being able to identify where we can personally grow in the area of cultural competence. So
Yes.
I love that you are also a mindful SLP.
To the
Um,
best I can, I'm getting there.
it's wonderful. It's wonderful to share that and talk about that with other clinicians who are practicing. And I think it's so very important. And it can feel like a newer topic to some. Some people might
Mhm.
think mindfulness is woo-woo, but if we even just take away the word mindfulness and we look at awareness, right? Like just opening our awareness to
Yes,
people's lived experiences and what
right,
they're going through and what they're bringing into the situation that may or may not be what we're bringing,
right.
and reflecting on that. So I really appreciate that. Thank you for sharing that with us today. So I'm really excited for anybody that's listening. If you want to reach out to Dr. Katrina Miller, is this something where you have resources available online, or you have links that you might be willing to share with us?
I have some general information in terms of my website. I do have a website, and that's katrinaemiller.com. You can find me there.
Okay.
And I've also recently done a book, which is totally separate from
Oh,
this, but it's a book
great.
of meditations for healthcare workers. And it's based on my experiences as a speech language pathologist. So it's a little bit of reflective practice in terms of the lessons that I've learned as being a practicing clinician. And these lessons span so many things, from my students when I worked in the school system, from my students as a university professor, to my colleagues that I worked with, to my occupational therapists, physical therapists. So it's conglomeration of lessons that I've learned, or reflections that I've experienced throughout my career. And that's also can be purchased through Amazon, and there's a link also on my bio. Mhm.
Amazing. And what is the title of this book?
Soap notes, cleansing thoughts for healthcare workers.
I love it. All right. Anybody who's listening, we have the links right below this show where you are watching. So you can go ahead and click and head right to Amazon and check out that book. I think that is so amazing.
Yes,
Congratulations.
thank you, thank you. Very exciting. Yeah.
Yes, that is exciting. Well, thank you for being available and for sharing your resources. And for anybody who wants to take a deeper dive into this topic and further your education, please check out Cultural Responsiveness and Reflective Practice in Clinical Supervision. And this can be found on speechtherapypd.com. And this is with Dr. Katrina Miller. For other topics, when you subscribe to speechtherapypd.com, you're going to get 1 year access to over 900 live and on-demand courses, and you're going to earn those ASHA CEUs. If you're new to speechtherapypd.com, you can access a free course. So go ahead and check out that information below this as well. And if you found this video with myself and Dr. Katrina Miller helpful, go ahead and give it a thumbs up. We want to hear from you. So feel free to comment in the section below. Be sure to subscribe to get notification for all the upcoming episodes that we have, where we are bringing in industry leading experts to give you the answers you need to build your know-how and step up your game.